Is our health system is ready for Omicron? The emergence of highly transmissious Omicron surveillance of the coronavirus reminds us how uncertain the world has become. Despite vaccinations, the third world of the pandemic indicates that COVID may continue to remain a part of our life. Experts have cautioned that the virus may not be wiped out fully and could continue to prevail and affect people. But over time, it may become weaker and the fatality rates may decline. Omicron seems to signal the beginning of that phase. Hence, they have to prepare themselves to navigate through its perils and learn how to survive. In the face of the rapid surge of Omicron, several countries are reinstating strict measures, including travel restrictions and quarantine of travelers. Citizens are being alerted to the dangers. Companies are revising their coping strategies. For example, a global financial company has made vaccinations mandatory for its staff if they want to keep their jobs. Some companies have announced work from home policies for an indefinite period of time. In Bangladesh, the government has announced some directives recently. While people have been asked to strictly follow health protocols, further directives to control people's mobility are supposed to become announced soon. How some of the announcement measures are inadequate? People traveling into Bangladesh would have to undertake an antigen test post arrival. This is a very weak measures compared to what has been announced in India. All travelers will have to undergo 7 days of quarantine and an RT-PCR test on the eighth day. Antigen tests are not very reliable in detecting the coronavirus. That is why it is not accepted in most countries. The health ministry therefore should take stronger measures. We may recall the weak measures for international travelers in the early days of COVID 19 had been a reason for the first spread of the virus in Bangladesh. Then the first and second waves, countries enforced lockdowns and border closures. However, that was not very successful. Of course, continuous countries such as China could control the spread of the virus quite successfully, but have had to see the economy shrink. Indeed, the global economic output reduced significantly. Poor countries are hit hard and did not have enough fiscal space to support the poor and various economic sectors. Like many countries, Bangladesh government had announced lockdowns in 2020 and 2021. Enforcing measures like controlled shutdown, use of masks, and maintaining physical distance helped reduce the spread of the virus. The rollout of vaccinations further helped to reduce cases. However, there has been a lack of seriousness among the common people in following protocols of late. A large number of people do not wear masks in public places. This highlights the need for constant efforts towards awareness building through various platforms. Almost 2 years into the pandemic, this is also time for Bangladesh to reflect on how we prepared ourselves in terms of healthcare facilities. The health sector has always been financed, with all an allocation from around 1% of gross domestic product GDP. This sector suffers from inadequate human resources, facilities, and innovations. Unfortunately, even with only 5.8% allocations in the total annual development program in 2021 to 2022 fiscal year. The health service divisions could spend only 6.5% of its allocation during July November of fiscal year 2020. This is unfortunate since there is a need for a higher spending on health services during the pandemic. The allocation for various ministries and divisions is determined by the Ministry of Finance on the basis of the capacity to spend. So naturally, there will be lower allocation for the poor countries. The capacity of health system compared to the needs of patients even during normal periods are far too low. Since the outbreak of the pandemic, some capacity has been developed, but essential facilities such as ventilators, hospital beds, intensive care units in the hospitals are still awfully inadequate. There's a need for higher allocations, but the quality of healthcare services and the inherent weaknesses in the system cannot be improved with higher allocations alone. The sector has to be revamped through reforms since much of the problem is linked to the governance of the sector. How government funds are used, who gets contracts, who oversees procurements, as well as the quality of the supplies are some of the issues that need to be scrutinized and streamlined. The number of healthcare professionals also have to be increased urgently. While bigger investment by the government is needed to ensure affordable healthcare, the private sector also has to invest more. The private sector needs to increase and improve their services considering the high demand. Reputed international hospital chains may also be brought into collaboration with local private investors. It's essential that the government ensures proper regulations and monitoring of these hospitals. Our dealing with the coronavirus successfully will largely depend on a robust and affordable health system. Policymakers should utilize the lessons and learned in the past 2 years and be prepared for a possible third wave.